Well, getting information out is what this doctor is trying to do as well, too. His name is Dr. Ranjit Ranawaya, who's a neurologist at Alberta Health Services and an expert in movement disorders. Try fitting that on the business card, sir. Explain your position. Explain what, are you involved in research as well, too, doctor?
So I'm involved in clinical research, but we have other individuals in our movement disorder program. I've got 4 other colleagues. There's a program called the Movement Disorders Program where we see mainly patients with Parkinson's, but we also see people with other movements, either lack of movements or too much movement. For example, Huntington's disease, one of my colleagues actually sees children with Tourette syndrome who have extra movements or, as well.
Also speech issues as well, too?
That's right, yeah. We essentially cover most of southern Alberta and eastern British Columbia in terms of looking after patients with Parkinson's disease.
We have for you, doctor, as well, too, a video question, so we invite you to take a look and to have a listen. For you, doctor.
My name is Georgia from Toronto, and my question is for Dr. Ranawaya. What are the symptoms of Parkinson's disease?
Well,
symptoms, sir.
Parkinson's, first of all, let me emphasize that it's a neurodegenerative disorder, so it's similar to Alzheimer's disease, but not the same as Alzheimer's disease, and it's the second commonest neurodegenerative disorder in Canada. There are about 100,000 people suffering with Parkinson's in all of Canada, probably about 10,000 in Alberta, and probably about 5,000 in southern Alberta. It usually starts with a arresting tremor. So it's a tremor when the patient is not using the hand, they get what's called a pill-rolling tremor.
That's what Linda, you mentioned, yes?
However, it's only about 60% of patients have that tremor, so 40% do not have a tremor. However, if someone has a tremor, it's easy to identify those individuals. And the nature of this tremor is that when you move your hand, the tremor disappears, which is different than the type of tremors you normally see in older people where when they're bringing a coffee or tea to the mouth, it shakes. That's not Parkinson's disease. However, associated with tremor doesn't give you a diagnosis of Parkinson's. You need to have slowness of movements. And most of the movements which are affected are movements where we use alternate sets of movements. So for example, handwriting, and Linda mentioned earlier that her handwriting got smaller. Patients find that they are slower at tasks, so they have trouble getting out of chairs, turning around in bed, getting out of low chairs.
It's not an achiness, it's more of a, why can't I move as quickly as before?
That's right, yeah. Some people do complain of stiffness, and we notice what's called rigidity. When we move the limb of the patient with Parkinson's, you notice that there is resistance to movement. So there's stiffness, slowness, tremor in about 60% of patients, slowness of movements. And they also have physical changes. Many patients notice that they are stooped forward, the facial expression is reduced. When they walk, they don't swing their arms as well.
Interesting.
And it usually starts on Parkinson's always starts on one side. So it doesn't start on
same
both.
Side or always?
It could be either way.
Okay.
We find that patients who have the symptoms on the dominant, dominant hand come to see us earlier because they're more tasks are affected. If it affects the non-dominant side, a lot of times we don't see these individuals until it spreads to involve the other side. So eventually it does affect both sides. But even at late stages of Parkinson's, you can tell which side was affected first.
And how long do typically, how long can you live with it? Is it different for every person? Because I know you get diagnosed later in your life. So
everybody's different, and I tell my patients, just look at yourself. Don't compare yourself with someone you see in the support group or, you meet people, because some people have a slower illness, others have a much faster illness. The younger you are, the slower the illness, and again, it's individual.
What do we know? What do we know? Back in 1997, when this young lady realized there was something going on, what do we know today about Parkinson's that is it? Again, I don't want to sound naive. Preventable? Are there ways to help us work through this? Give us a little bit more.
So what we know is what's happening in the brain is a group of cells in the brain which produce dopamine, and the dopamine is used for control of movement. And we know that in patients with Parkinson's, there is a clumping of a protein called synuclein, which eventually damages the cell and leads to death of the cell. And we know that you need to lose about 80% of the function of the cells before you have symptoms of Parkinson's. So when you present with Parkinson's symptoms, it's possible that the process may have started about 5 to 10 years before.
For heaven's sakes.
But you didn't have any symptoms.
Right.
And we don't understand why the protein, which is a normal protein in all cells called synuclein, somehow starts clumping and gets eventually damages the cell. Right. So, and there are many theories about this. There is in about 5% of individuals, there is a genetic component, so it runs in the family.
But that's only 5%.
Only 5%. In 95% of people, there is no genetic component.
Yeah.
And there are lots of theories about as to what may cause this to happen. It could be environmental toxins, herbicides, and early on when we were talking, you mentioned that when Michael J. Fox was diagnosed, or at least he has Parkinson's,
yes,
a large proportion of people who in the studio with him also develop Parkinson's.
25%.
So there are some people believe that it could be an exposure to a virus, for example. And we know that there are some viruses which can cause Parkinson's-like symptoms. It doesn't necessarily cause Parkinson's disease. For example, West Nile virus in a small percent of individuals, it affects your brain. They can have Parkinson's symptoms because the part of the brain which produces dopamine is also affected.
Doctor, we have so many questions for you, and there's so much research being done. I really appreciate you being on panel this morning.
No problem, yeah.
We'll ask you more questions as we progress through this.